Dr. Luke Roller. I'm a radiologist. I'm originally from Bismarck, North Dakota. I went to the University of North Dakota Medical School, and then I went to the University of Minnesota for radiology, and then I did a one-year fellowship in interventional and vascular radiology. Well, since I've been done with training, I've been back in my hometown, Bismarck, North Dakota. I have worked for an independent group in Bismarck, North Dakota, which services one of the trauma level 2 hospitals in Bismarck. And then we also do radiology for a number of the critical access hospitals in Western North Dakota. And then about 2 years ago, about 2 years ago now, I formed a separate independent side group. It's for teleradiology purposes with another radiologist friend of mine who also works for the group in Bismarck, but he actually lives in Minneapolis and kind of reads remotely for us. We founded a small group called Independent Medical Consultants to pick up extra contracts and try to serve people that we felt were underserved. We have a lot to do the right thing first. In a teleradiology setting, the way to do that is to use telephones, to use cell phones. Call me when you have a question. Call me. Let's do the right thing first. We don't need to guess on things. We can call, collaborate. Sometimes they call and say, hey, can you look at this other thing again? I think they're having pain right here and you didn't talk about that. So great, thanks for the phone calls. Let's take a look at it again. Let's do the right thing the first time for the patient. I think my goal is so that, yes, I'm not physically here at Huron Regional Medical Center very often, but that I provide the service just as if I'm here. They can always pick up the phone and call me, and we can get the right answer the first time. I came to radiology late. I was a school teacher for a number of years before I went to medical school. I went to medical school thinking I was going to be an ER doctor. My dad was a longtime ER doctor in my hometown of Bismarck, Dakota. He grew up on a farm in Western North Dakota. But I decided I didn't want to be like my dad, and radiology turned out to be a great field. I love my job. If I had to go back and do it all over again, I would. But because of my father's influence, I felt a strong passion to come back home. I always wanted to come back home to Bismarck, even though I spent a lot of my time in training at the University of Minnesota in the Twin Cities. And that's, as a radiologist, in the last couple of years, working in my hometown, but then also working for a number of critical access hospitals. I just recognized how much I love my hometown, how much I love North Dakota, how much I love rural medicine. And yes, I don't technically live in a very small community, but I see their needs. I see how much they've sacrificed on behalf of their communities, and it inspires me to do that as well. I like being around the people. I was talking to some of the administrators. I like being around, taking care of my friends, their wives, their children, my parents' friends, their wives, their children. There's a big social responsibility to do the right thing, because if I screw up, if I don't do the right thing, my wife and kids suffer for that too, because we all live in a small town. But I also think it's a good thing because it forces me not to cut corners. It forces me to be good at my job, to keep current, to try to be the absolute best at what I do, and I love that. And so working for Huron Regional Medical Center really fits right in with the mission and values that I've tried to cultivate the last 7 years as a staff radiologist. Yeah, all the radiologists that I work with, all have specialty training. They've all done a fellowship in some area of radiology. All of us, though, that I've worked with, all of us read everything. We're general radiologists. We do everything. In some of the tougher cases, we tend to go with this other person who's got the fellowship training, their expertise. We're very collaborative in our approach to mammography. We like to show each other cases and make sure that we're in agreement with things. But we have extensive experience. We do thousands of mammograms every year, and we feel like mammography and women's imaging in particular, since this is such an important area of radiology, 1 out of every 8 women will develop breast cancer in their lifetime. We felt it was really needed to do that well, and that's something that can be done well in rural sites. You don't have to go to a big hospital or a big site in order to do that. Every community should be able to provide the services to women to be able to screen appropriately for breast cancer. Here at Huron Regional Medical Center, you have excellent equipment. You have a brand new CT scanner. You have an excellent MRI. You have excellent techs. You have excellent. There's no reason not to expect excellent care from a radiology standpoint here at HRMC. You don't need to go to, for most things, you don't need to go to Sioux Falls. You don't need to go to Minneapolis. You don't need to go to St. Paul to be able to receive the exact same quality care that you're going to get there. And I'm going to work to ensure that my interpretations, that our reports are just as accurate, are just as precise, are just as up to date as any of those facilities. A lot of our, in my area of North Dakota, a lot of our higher end or higher acuity patients or higher need patients go on to University of Minnesota and to Mayo for additional care. I want my reports when they follow my images that those radiologists there think just as highly of my reports as any other radiologist that's there. And I work hard to ensure that I'm accurate, that I'm up to date on all the newest language, the newest techniques to make sure that they don't have to get repeat scans, they don't have to get a bunch of repeat imaging when they go onto these other sites. And I think, like I said, Huron Regional Medical Center is well positioned for that. I'm going to make sure that happens here as well.